Okay, so we talk a lot about climate change, global warming, impacts, extreme events, and so on, and not so much about air pollution when it comes to climate courses. And yet, air pollution kills, maybe millions of people every year, premature deaths, and then it has lots of morbidity issues in terms of making people sick. We have discussed climate and health and air pollution and various health issues, mostly respiratory issues, but also diabetes. There's a nice article that just came out in the Lancet uh, franchise. I think it's called Lancet something or the other, but yeah, Lancet Healthy Longevity is a journal. So this paper appeared there, and this little piece is a summary of that paper with some perspectives: air pollution and brain health. I'm reading this and not touching the paper because the paper has survey data and some analysis of making the links. But some good points are made in this little article, so I'm going to read all of the text. Uh, I will add a couple of my own points. The global burden of dementia is increasing as the population ages. Everywhere, fertility rates are dropping. Many countries are below replacement rate of 2.1 children per couple, and so on. The number of people with dementia in the world is 57 million and is predicted to increase to 153 million by 2050, driving a global surge in economic burden and social impact. So the peak populations and dropping fertility rates, etc., are going to give us, aging population. There is the issue of how to take care of them, and then also about if there are additional factors like increasing dementia, then that gets even more urgent. The 2024 Lancet Commission highlighted air pollution as one of the 14 potentially modifiable risk factors accountable for approximately 3% or 1.65 million of global dementia cases. Globally, air pollution is the largest environmental risk factor for disease and premature death, responsible for 9 million premature deaths annually. There's always the attribution issue because air pollution tends to exacerbate pre-existing conditions, but it's a risk factor, and children and elderly people wheezing through pollution is enough to make you stop and think about pollution mitigation actions. So although lesser evidence links air pollution to dementia than that available for other health outcomes, such as chronic obstructive pulmonary diseases, COPD, and cardiovascular diseases, the field has been growing rapidly. So when we talk about deaths due to natural hazards, we can say less than 1% of the total deaths are related to natural hazards, whereas more than 30% of the total deaths are cardiovascular related, and air pollution plays there. So we have to worry about air pollution as an issue by itself. The mechanism behind this association is not yet fully understood, but plausible explanations include the increased risk of hypertension, oxidative stress, insulin resistance, and inflammation due to exposure to the fine particulate matter, or what we call PM 2.5. So, as I mentioned, it is about diabetes and hypertension, which is blood pressure and so on. And this, in their article in the Lancet Healthy Longevity, Thomas Canning and colleagues examined the associations between life course exposure to ambient air pollutants and cognition and later life brain structure using the 1946 British National Survey of Health and Development data, including Insight 46, the neuroimaging sub-study. The authors found that higher exposure to air pollution between the ages of 45 and 69 years was significantly associated with adverse cognitive and structural brain outcomes. Specifically, for every interquartile range increase in nitrogen dioxide exposure, processing speed decreased by 8.12 points in a 15-item recall task. So that's one of the medical ways of, you give people things to remember, and you ask them to recall after some time, and you increase the number of items they have to recall, and then you begin to measure their ability or lack thereof to recall items. Exposure to all pollutants was associated with poorer cognitive performance than no exposure, as evidenced by the lower scores on the Addenbrook's Cognitive Examination 3 brief standardized cognitive assessment. So it's the Addenbrook's Cognitive Examination 3 brief standardized cognitive assessment, that's the name, at age 69 years. So over time you end up having this brain damage. For example, higher exposure to nitrogen dioxide was associated with 0.59 points lower Addenbrook's Cognitive Examination 3 scores at this age. At ages 69 to 71 years, higher exposure to nitrogen oxides was associated, NOx in general, was associated with smaller hippocampal volume with an average decrease of 0.088 per unit. So these are obviously statistically significant numbers. And additionally, higher exposure to nitrogen dioxide and particulate matter with a diameter of less than 10 micrometer was linked to a larger ventricular volume. Okay, larger ventricular volumes. These new findings, which suggest that all air pollutants are associated with poorer cognitive outcomes at age 69 years, are consistent with those of previous literature, and this study is novel owing to its focus on lifetime exposure and not solely midlife exposure, and thus providing a long-term perspective on the effects of pollution on cognition and brain structure. The long-term nature of the study is particularly valuable given that the follow-up length in many previous studies has been less than 5 years, a period that's too short to detect associations between exposure and outcome, both of which are most likely to develop over many years. And evidence suggests that a longer follow-up period increases the possibility of identifying a stronger association or better attribution. The link of particulate matter with a diameter of less than 10 micrometer and gaseous pollutants with increased ventricular volume and reduced hippocampal size builds on findings from the few existing studies, further contributing to the current body of research. Uncertainties about the association between air pollution and cognitive status still remain. Data on indoor air pollution were not available for the 1946 British National Survey of Health and Development cohort, but are important for future research. So we can still do these studies because pollution keeps increasing. Although external ambient air pollution is linked to indoor air pollution, other pollutants such as solvents, smoking, residential cooking appliances, and occupational pollutants also contribute to lifetime exposure to air pollution. In poorer countries, developing countries, or countries where culturally biomass is used for cooking or heating inside the homes, obviously have large impacts on indoor air pollution, and this study doesn't necessarily cover that. Indoor air pollution is a particular problem in low-income settings, and the same is true of ambient air pollution. Of the 7.3 billion people exposed to unsafe concentrations of particulate matter with a diameter of less than 2.5 micrometer, so greater than 5 micrograms per meter cube in concentration, pollution size matters because it's how easily it gets into lungs and maybe digestive tracts and through the cells into bloodstreams and so on. Depends on the size, but concentration also matters. So greater than 5 micrograms per meter cube is a WHO standard, but most countries exceed this. And as I have another podcast, we basically have no safe air anywhere in the world at this point. So 2.5 micrometers, 3.4 billion let's read it again. I added some comment and lost the track. Of the 7.3 billion people exposed to unsafe concentrations of particulate matter with a diameter of less than 2.5 micrometer at greater than 5 microgram per meter cube of concentration, 3.4 billion or 47.3 billion live in low income and or lower middle income countries, so who are particularly vulnerable. As Canning and colleagues indicate, the association between higher exposure to air pollution in midlife and cognitive decline suggests that air pollution could be a risk factor for dementia. However, further studies with dementia as an outcome are warranted. Air pollution was identified in the 2024 Lancet Commission to be a late life risk factor for dementia. The findings of Canning and colleagues, which link midlife exposure to air pollution with poorer cognitive state, suggest that air pollution could have an effect on dementia risk earlier in life. Further studies are needed to disentangle the timing and cumulative effects of life course exposure to air pollution and subsequent dementia. Overall, the findings of the study by Canning and colleagues strengthen the evidence that air pollution is linked with poor brain health. Small reductions in exposure to air pollution, even in midlife, could allow for improvements in cognition and brain health and confer other health benefits, thus emphasizing the importance of continuing global efforts to reduce air pollution. Realistically, air pollution cannot be reduced by individual action, but only through public health approaches. So governments, whatever public-private participation with stakeholder engagement as well. These approaches include implementation of the commitments from the WHO Global Conference on Air Pollution and Health, such as increasing investment in sustainable transport, clean energy, and legislating to keep air pollution within the WHO recommended limits. Okay, so as I said, it's a relatively brief summary of another article, but I thought it's really worth looking at this as brief as it is without going to the original paper for the data and details, which you can do. But obviously we have to worry about such issues now. Climate change, climate action, mitigation, adaptation, all good, but air pollution, which has somehow not been closely associated with climate change, even though we keep mentioning that renewable energies will have co-benefits on air pollution and so on. We haven't tackled coherently all sources of pollution. NOx, for example, just comes from vehicles, and moving to EVs will obviously help that as well, but EVs need energy, and that energy has to be clean, so there's always these nexuses between